Welcome to Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our goal is to provide a platform where we can educate, advocate, and inspire women leaders to lift as they rise. With every episode, you'll hear from her as we showcase the perspectives, insights, and experiences of women who are leading the way in advancing women's health and empowering the next generation of women in healthcare.
Welcome to today's episode of Medscape's Hear From Her, Women in Healthcare Leadership podcast series. I'm Elaine Bell, Director of Clinical Strategy at Medscape. I'm excited today to be talking about female leadership in the field of aesthetic medicine. Joining me are two incredible women leaders in this field. First, Dr. Tatjana Pavovich. She's a board-certified dermatologist specializing in cosmetic surgery and aesthetic treatments with her own private practice in Munich in Germany. Her specific focus is on a holistic, individualized approach for face and body, combining botulinum toxin, fillers, and energy-based devices. She's an internationally respected speaker and trainer on advanced cosmetic dermatology and surgery. Welcome, Tatjana.
Thank you, Elaine.
Also joining me today is Dr. Terry Phillips, MD, the Chief Medical Affairs Officer at Merz Aesthetics. Terry is a dual board-certified MD. At Merz Aesthetics, she leads the Global Medical Affairs team, who support the development, launch, and lifecycle management of innovative aesthetic medicine products. She's passionate about equity, inclusion, and reducing health disparities, and actively supports initiatives that empower women and other underrepresented groups in the healthcare sector. Welcome, Terry.
Thank you, Elaine.
Okay, so today we're going to discuss how we can close the gap and empower women to excel in leadership positions in aesthetic medicine. So let's get started. I wanted to begin really by asking both of you about your personal journey as female leaders in aesthetic medicine. Let's start with Tatjana. How has your background, Tatjana, and experience enabled you to become a leader in aesthetic medicine?
To my background, I'm originally born in former Yugoslavia, and I basically experienced war in former Bosnia when I was 15 years old. So basically that teaches me to adapt to different situations because I came to Germany. I didn't really speak the language properly, and it was a completely different country, complete new people. So you have to always adapt to the situation you have. And I think that makes a good leaders, that we do not just focus on one thing, but that we are able to adapt to different situations, different circumstances. And what is, of course, very important, as a leader, you have to rely on your own work. And as a leader, we always should also not just focus on ourselves, but actually give a good example to other people. And also as a mother, that is my third role, basically, beside being a doctor and a leadership in aesthetic medicine and being a key opinion leader. I need to give a good example to my son how to become a leader himself.
Thank you, Tatjana. Terry, let's turn to you for the same kind of question. Can you tell us about your career journey and what particular experiences that have led you to your current leadership role?
Yeah, first I have to say I'm always inspired to hear Tatjana's story. I just can't even imagine what you experienced as a 15-year-old, so thanks for sharing that again. My leadership journey has been very serendipitous. I never sought to be in a leadership role, but found myself in leadership roles frequently. And I think that comes from maybe having a military background. So I was, in my medical school, I was actually supported by a scholarship from the United States Army. And I spent 7 years on active duty, 7 years reserve. And then in the military, there are amazing leaders. They really demonstrated to me how large organizations like the United States military actually make decisions and communicate across the world when they are in times of war, how they can get the collective group to work together. And so I was fortunate to have a lot of great mentors, some of them from graduates from West Point who were physicians, but who were in my leadership, in my training during my residency and during my fellowship. And they gave me leadership opportunities. And so through the course of my experience in industry, in private industry, as well as in the practice of medicine, I kind of found myself in leadership positions. And I think it's because I when I see a challenge or I see an opportunity, I seize it. And I also, I'm the fourth child of six. I think because of my family position, I'm a natural collaborator. I've had to always be able to, get things done in my family. So I think that lends itself to, as a leader, understanding how it takes the entire team to be successful. So I have the great pleasure to lead, but I have an amazing team who really helped me to execute on some very, very strong strategies.
Thank you both for sharing that. It's really interesting to hear how your backgrounds have influenced your development of your leadership roles. I'm going to turn now to Terry and ask you, increasing numbers of women are really seeking aesthetic procedures, and there seems to be a growing demand for non-invasive procedures in particular. And I'm just wondering about, the influence of celebrity culture and social media pressure as key drivers of demand. And I wanted to ask you, what do you think can be done to tackle the negative impact of social media from the commercial perspective?
Yeah, it's a great question. Social media, there's no question. The celebrity culture, influencers on social media, they play a huge role in aesthetics. And some of the information that's on social media is true, but much of it is not. And I think that the role that we play is to make sure that when there is misinformation, that we correct it, that we give people access to what's real, what's based in evidence, what's based in real science and data, and to accept that social media is here to stay and use it as a powerful educational tool, really to influence with truth. That's really all that we can do, is just to set out to tell the truth at all times and to help the consumer understand what's real and what's not.
That sounds really positive way of tackling things, and it's very interesting to see how the whole culture is developing. I have a similar question actually for you, Tatiana, in terms of what's your experience been as a practitioner in managing patient expectations when those are very heavily influenced by sort of social media pressures?
Yeah, thank you very much. This is a great question because basically this is probably one of the biggest challenges that we face in our daily work, especially with younger generation patients. I'm based in Europe and not in Asia, where they see even younger population. But if you looked at, for example, in Asia, from the age of 18 to 28, they're 30, they spend sometimes 6 hours a day on social media. And they sometimes come with really completely wrong expectations or wrong impression what can be done with which kind of treatment. And of course, that takes much longer to consult these kind of patients. However, I think as a MD, as a doctor, it's my responsibility to really make a proper assessment, and on this assessment-based diagnosis, and then based on the diagnosis, to try to explain and maybe even convince, if they have different opinion, my patients, what would be the best treatment for them. That means very frequently I have to say no. I try to explain them why I say no, what would be the appropriate way, how we can find together. When I send these patients away, though I definitely know they will find a way to get the treatment they want, but sometimes, there is a little bit like satisfaction when after some of them, after treatment done somewhere else, come back and say, yeah, you have been right. You consulted me properly. Can you fix it then?
I think those are great points, that ability, strength to say no in the face of, pressure, and to be able to really put your patient front and center is key. Absolutely. Terry, I'd just like to ask you, from your industry perspective, what innovations in aesthetic medicine are getting you most excited today and looking into the future?
Thanks very much for that question, Elaine. We are really excited about the emerging field of regenerative aesthetics. I think people understand this to be the ability to use one's own healthy tissue to actually preserve and regenerate youthful structures within our skin. What we see on the outside is a reflection of what's under the surface. And so if you have healthy foundational structures, your cells, your blood vessels, all of the things that are part of having healthy, youthful appearing skin, those have to be in place. And the body does have the ability to regenerate that. We're particularly excited about biostimulators. For us, it's calcium hydroxyapatite in CMC, in a CMC gel. And when this product is injected, it actually provides a nice scaffold for the skin so that the body is able to regenerate its own healthy collagen, its own healthy elastin, and all of the other foundational things that we see in, like proteoglycans, for example, that give skin its glow. So injecting some of these biostimulators actually leverages the body's own ability to regenerate healthy foundational structures, including new blood vessels, so that the skin appearance is more youthful, it's more elastic, it's has its glow, it has all of the qualities that we like to see in natural, healthy, youthful skin.
Thank you, Terry. I mean, personally, I'm really fascinated by the science of the bioregeneration and biostimulation. As an immunologist by background, just really understanding the science. I think people don't really appreciate how much science goes into it these days, but it's certainly fascinating for me. Tatiana, similar question for you, please. What do you think are some of the advances in aesthetic medicine that you're particularly excited about introducing to your own personal practice?
There are multiple developments now. So I was always actually standing for individualized treatment approach, for natural looking treatments. I always say if the treatment is well done, you don't see it. I mean, if the patients do not speak about that, that is not really obvious what I have done. It's just simply, hey, you look so fresh, you look so relaxed. I think the trend to regenerative aesthetics that people ask for something natural. And I really think, especially with calcium hydroxyapatite CMC gel, where we have so many evidence-based data, so many real clinical study, including the immunology, that is not always easy for most of doctors, especially those active in aesthetics, to understand. But basically what happens that these particles are able to attract our own fibroblasts, and not only in young skin, but even in aged skin. And then they start their regular work. And that means we do not have just collagen type 1 and a firm tissue, because that can also be scar. It's not a characteristics of a healthy skin, but we have a proper ratio between collagen type 1 and collagen type 3. We have elastin, because firm skin is not elastic. We need this plumpy appearance that children have. We need the production of proteoglycans and glycosaminoglycan to give a hydration and a healthy glow of the skin. But as I always say, the fibers and the cells can't survive without oxygen. And who brings oxygen into the skin and any other tissue? These are the blood vessels. And I think the other big developments that support all these individualized treatments is, of course, the use of artificial intelligence. It has already started in general medicine, but now more and more also in aesthetic treatments, either by helping to perform treatments more precisely, more effectively, but also to analyze, so it means helping diagnostics. And of course, we need to engage with our patients. Our patients today have multiple information they want to exchange. They want to take active part in our treatment journey. And these are the patient-centric digital services that we now offer more and more our patients, so that they can really exchange and ask their questions because they want to be informed. And I think this is also for us physicians, at least for me personally, I like to take my patients on a journey together as a team.
That's fantastic. Thank you, Tatiana. I think it's going to be really fascinating to see how the whole field develops in the next few years. But let's circle back a bit more and focus on career development for women leaders in this space. Terry, what do you see as the key challenges and barriers for women to become leaders in aesthetic medicine companies? And what do you think can be done to really elevate women in this field?
Great question. I love it. I think the challenges are always very similar over time. For me personally, the challenges were around combining my professional career with my personal life. I'm the mother of 4, and raising a family while also pursuing my own professional goals was very important to me, but it was challenging. And I think I didn't necessarily see a lot of women combining professional careers and motherhood. For me, that was a gap. I think it's really important for young women to see that it is possible. On any given day, you're not going to be the best mother and the best professional, but you can be the best of both of those over a blended time frame, if that makes sense, right? When you see it, then you can be it. When you don't see it, you're not sure you can be it. So I think having more and more women professionals who are demonstrating, and we're seeing a lot of that in the field of aesthetics. We're seeing women like Tatiana and some other very prominent female leaders in the field of aesthetics who are openly combining motherhood and professional careers, bringing their newborns to meetings with them and being global thought leaders and not limiting themselves because of their desire to really have both of those. We are accepting the fact that women can have both of those and can be very, very successful professionals and combine that with motherhood.
Absolutely. I couldn't agree with you more, Terry. And it's really interesting to hear this as a common theme coming through many of my conversations I have with women leaders. Tatiana, from your perspective as a leading practitioner, what have been the key challenges that you have faced and what has helped to overcome those?
Yeah, basically, I would share it in two parts of my life. The one was before my son was born, and then after my son was born. At the beginning of my career, it was actually really dealing with stereotypes in medicine, because originally I wanted to become a plastic surgeon and not a dermatologist. And it was, this blonde girl, and are you really going to assist me in this knee surgery where you need force? And I think we women, it's not about really just simple strength and power, physical one, but it's also about the skills. And women have proven to the entire history that they are actually the stronger gender. So also women over centuries enjoyed to be at home, to take care of the family, of the husband. But I'm pretty much sure that every woman has two different sides. The one thing is, and maybe even three, I want to be successful in my career and my profession. I also want to be an attractive woman, and that sometimes can also be a barrier, because if you are too sexy, nobody really takes you seriously. And then also, of course, we want to be a good partner in the relationship and also good mother. And to bring all of that under one hat is not so easy, but if you look, even if you ask men, who is the gender that is multitasking, it's always a woman, because the nature has done it like that. So at the beginning, it was rather this, a little blonde girl, too sexy. And was really all the stereotypes that I faced. And still, if you look at the leading positions in the hospital where we do our education and where we start our careers, it's still most of the really, like the head of the departments are men. Because, it's simply easier, especially in the very vulnerable phase of our career. This is where women usually become mothers. And then you are out for a certain period of time. And then everybody says, yeah, but if I have a man and a woman who has same qualification, I'm going to take a man because they're not going to be out for 2 days if a child is sick or something like that. And this is something, I must be honest, I personally was very lucky when my son was born, that I have a partner who is supporting me a lot, and that I had my parents who live in the same city where I lived. So maybe that would be for the future very good if we would get back to the old family structures where grandparents would support their children and by taking care of their grandchildren. Because whom can I trust more than my own parents to take care of my son? And still sometimes, look, today is the first summer holiday days of my son, and it's 7 p.m. for me. I left today at 8:20. He just waked up, and I will be home at around 7:30 or something like that. But I think it's very important to speak to your family, to your children as well, and to explain them. And my son rather sees me as an idol than a bad mother who hasn't been there every day. The time that I take for him is actually very quality time where I just take care of him. And that's the same basically that my mother did with me as well.
Yeah, there's that. I think I hear you. You know, the importance of a good support network is really absolutely key. Whether that's your parents or whatever friendship groups you built up locally, etc. But having that support network that you can actually call on in times when you really need them is absolutely critical for being a mother and trying to be a woman leader as well. And Tatiana, I'm going to throw in a question I didn't actually have on my list, but you touched on education, and maybe I can ask you both a little bit about what your thoughts on the importance of or the value of education in this space. And I'm thinking both from the need to provide. We're an accredited education provider, and traditionally that's not often been a route that aesthetic medicine has gone down. I wanted to ask both of you your opinion about that provision of accredited education for physicians, as well as, we've talked a little bit about that, making sure we educate patients on expectations. But in terms of educating physicians, what are your thoughts around that? I'll throw that to you first, Tatiana.
Okay. Education is really the cornerstone, but also including theoretical and practical education. Unfortunately, in most of the countries around the world, as soon as you become MD, you don't even have to be specialist in any type, not ENT, not plastic surgery, not dermatology. Doctors are already allowed to inject, and sometimes they believe if they have joined 4 hours training, they can do everything. That I think it's quite dangerous for our patients because of all the variability of the anatomy, of all the variability of the products that we have on the market. And I think, and I would definitely support it also in my role as a DASIL president, that is International Society, to have accredited and a standardized education for aesthetic treatments. When I started injections in 2005, I was the lucky one who was supported by the head of the dermatology department in Munich to set up the department for aesthetic dermatology, where I could educate other younger doctors at least a little bit. And still, I enjoy teaching as much as I do treating patients. So learning never stops, basically. And this is something that I sometimes would like to take some of my colleagues and shake them a little bit to say, hey, you are not the almighty one. You can't know everything, so better listen. And if you have a chance to pick up even a small tip, a small practical advice, even if it doesn't sound really high scientific, high evidence-based medicine level, this is always very useful. But we need the standardization, like we have it for any other specialty. I had to join 5 years of residency time for dermatology. And for the aesthetic treatments, as I said, sometimes it's enough to have just 2 hours. And I think basically, meanwhile, we have very good educational tools online. We also have it in like a hands-on trainings. I think you need both. People who would learn first the basics and the terminology and everything about the products that you can do in theory, and you can do it online without traveling so much, without losing so much time of your office or from your family and friends and your private and social life. But then in the end, you really need hands-on training, especially for injectables or even the lasers or energy-based devices, because every machine is as good as its user. And for that, someone needs to take your hand and say, hey, this is what feels right, this is what feels wrong. With injectables, we can inject on the cadavers. That is really reliable to the daily practice.
It's interesting. We were actually speaking last week with Yanni van Lochem in the Netherlands, and he was telling us there is now actually a specialty in aesthetic medicine in the Netherlands, which is a big step forward. Terry, do you have any thoughts on the education side of things and the need for sort of independent education?
I think the biggest challenge we see in aesthetic medicine is exactly what both of you have talked about, and that's the lack of an accredited path. So in the United States, for example, I have a specialty in neonatology. There's an accreditation path to that, and I take a board certification exam. Aesthetic medicine is a fairly young field relative to other specialties in medicine. Really, it evolved since the early 2000s. And there is a ton of innovation, but no firm accredited pathway. And these are very, sometimes can be dangerous procedures that we're doing. There is, as Tatiana alluded to, there are variations in anatomy. Every individual has their own set of blood vessels and nerves, and you can't approach aesthetics like it's some type of treatment map, because the patient is an individual And I think that there is so much innovation that happens in aesthetic medicine every day that the need for accredited education is ongoing. And aesthetic medicine, given its relative, newness in the field of medicine as an emerging specialty without a firm accredited path, even more so needs that accredited educational pathway. People need access to that because they need to treat it like the serious discipline that it is, with very serious and important outcomes for patients and patient safety. And so I don't think that this need will ever go away. I think that everybody who does it well takes education very seriously, and they continuously learn.
And this is exactly why Medscape felt the need to set up our specialty page on aesthetic medicine, because from our perspective, we thought that was a very complementary approach to really make sure that we provide high-level education available for learners. I wanted to ask you both, what are your top tips for women to develop leadership roles in aesthetics? Tatjana?
Now I'm going to be a little bit direct. Don't care what others might think of you. Don't let yourself being stopped if there are some barriers, even if they might be or might look quite severe. I really believe if you want something and you fight for it and you work hard for it, you educate yourself for it, you can achieve everything you want.
Terry, any thoughts on top tips for women to become leaders in this space?
I think it's a similar flavor. It's I always say bet on yourself. So if you want to do it, then do the work to make it happen for yourself. You have the power within yourself to achieve your goals. There are many, many women who support other women, and find those women, access those women. And, if someone is doing something that you aspire to, I tell people all the time, social media is a great connector, right? It's amazing when you identify someone who is achieving great things in their field and you aspire to it. Many times, if you simply reach out to that individual online, they will respond. Many, many people are very open to sharing their own experiences, their own best practices, their own advice to aspiring young professionals. And so I always encourage people to reach out. Many people reach out to me on LinkedIn all the time. And to the extent that I can, and I've actually started to mentor a couple of people that identified me through LinkedIn, and I've agreed to, share some experience to help them. And so you'd be surprised. There are many, many people who are very, very open to doing that. So don't be afraid to reach out to the people who are doing the things you want to do.
I hear you both saying you can be anything you want to be. And I think from, my own personal background, I came from a family that, I was the first to go to university, and my father had a manual job, but his one key message as a father to us was, you can be anything you want to be. And it was a very, very powerful message to have as a child, as a female, to say, you can do whatever you want to do. You need to work hard and you'll get there.
Absolutely.
And I think we've pretty much come to the end of our time together, and it's been great to have you both here with me today. Any final thoughts for women who might be listening about working hard towards leadership roles in this space?
I think there are some clubs for old gray men. So I think we should found more female, doesn't matter, blonde, dark, or whatever, hair and skin color. I think the world is so bright. The world has become global. And luckily, we are so well connected due to the digital world now that you can, as Terry said, contact everybody anywhere to any time. And we all have our own experiences that we need to share. And I believe we women, we do not have to exclude men. I love men, so that's all fine. And we can also learn from them, as I said, if, for example, building a clubs like the gray old men do in medicine, in politics, actually everywhere.
Absolutely. I agree. 100%. Some of my best mentors have been men. Dream big, bet on yourself, and keep going.
That's fantastic. I've really appreciated hearing from you both today and your thoughts. And I just want to thank you very much to both of you for joining me today. I think it's been a great discussion. And to our audience, thank you for listening. Please watch out for the next episode of the Women in Healthcare Leadership podcast series.
Thanks for joining us. Tune in next week as we continue our journey to amplify the voices of women leaders in pharma and medicine. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next week, remember to lift as you rise.